An aerial view of a modern hospital building by a bay. Colorful papier-mâché animals and leaves hang from the high ceiling of a bright atrium. People walk through a bright hospital hallway with colorful wall accents.
The UCSF Craniofacial Center is the oldest craniofacial center on the West Coast.
A bald man in a white coat and blue tie speaks to the camera in a modern office. A title in the lower right identifies him as Jason Pomerantz, MD, Pediatric Plastic and Craniofacial Surgeon, Co-Director, UCSF Craniofacial Center, an aerial view of the hospital campus with a harbor and city in the background. An aerial view of another hospital campus in a residential area with a train passing by. A close-up of the UCSF Benioff Children's Hospital sign featuring colorful child skull. He and the mother look at it.
We have two sites, one at the San Francisco Mission Bay campus and another at the Oakland campus of the Benioff Children's Hospital. We see patients with any difference of the face or head, including craniosynostosis, cleft lip and palate, and many others. It's very distressing for a parent to hear that there's something wrong with their baby. I know this as a parent. And so when parents learn that their child has craniosynostosis, it's very scary. The good news is that this is a condition that, when recognized early, and if a child is brought to a center that specializes in this, like UCSF.
A father and mother watch their toddler, wearing a helmet, walk down a hospital hallway. The orthotist points to a computer screen showing a 3D head scan while the mother holds her baby. The orthotist smiles as he places a baby into a scanning device, with the mother looking on. He carefully places a white head covering on the baby, held by its smiling mother. He then fits a blue cranial helmet onto the baby's head, adjusting the straps.
It's very treatable.
Dr. Sun, a male doctor with long hair, walks down a hospital hallway, smiling at a toddler in a helmet who runs ahead of him. Dr. Sun speaks to the camera in an office setting, with medical models and awards on shelves behind him. Titles in the lower right identify him as Peter Sun, MD, Pediatric Neurosurgeon, Neurological Director, UCSF Craniofacial Center.
What's special about our craniofacial center in terms of treating craniosynostosis is that we've offered a full gamut of treatment options. We offer the full spectrum of care from open surgery.
A medical professional points to an X-ray image of teeth and jaw on a computer screen. Dr. Sun points to a 3D skull model on a computer screen and then points to before and after photos of a baby's head on a computer screen. He then speaks with a couple in an examination room while a baby in a helmet stands nearby.
To minimally invasive surgery, and in particular, with our minimally invasive surgery, children have to wear helmets afterwards to optimize the head shape. At our center, the helmet is done on site, so the families don't have to go to another helmet facility.
Dr. Sun measures the baby's head with a tape measure as the father smiles and watches. A toddler in a blue cranial helmet smiles at the camera. Dr. Sun and the orthotist review a skull model in an examination room, while the mother holds her toddler.
And I work closely with the orthotist to do any adjustments that's necessary in order to get the best results.
The orthotist uses a tool to adjust the cranial helmet. A close-up of his hands adjusting the helmet. Dr. Sun speaks to the camera.
It takes a whole team to treat craniosynostosis, not just the surgeons. We have a team that includes nurses, nurse practitioners. We also have a whole spectrum of medical specialists, from geneticists to ophthalmologists to every specialty that can be affected by craniosynostosis.
Dr. Pomerantz walks down a hallway with a female nurse holding a skull model. A female nurse greets a family in the hallway, shaking hands with a man and handing a paper to a woman. A team of medical professionals, including Dr. Pomerantz, sits around a table in an office discussing a case. A female nurse measures a baby's head with a device while the mother holds the baby in a helmet. A medical professional examines a young girl's mouth while an older woman sits nearby. Dr. Pomerantz smiles as he fits a blue cranial helmet on a baby held by its mother.
We've developed the UCSF Craniofacial Center to be a one-stop shop for craniofacial care.
Dr. Pomerantz shows a 3D skull scan on a computer to a mother holding her baby.
When the child comes for their annual visit, they get all of that care under one roof.
Dr. Pomerantz gestures with his hands as he speaks to the mother, who holds her baby. Dr. Sun speaks to the camera, gesturing with his hands.
We really look at each individual patient, and we tailor our treatment to them in order to get us the results we want.
Dr. Sun leans against a wall, observing a father and his toddler in a helmet in a hallway. Two toddlers, one in a helmet, play on a wooden structure in a bright room. Colorful fish and bird sculptures hang from a high ceiling. Colorful butterfly and bird sculptures hang from a high glass ceiling. A female nurse practitioner in a white coat speaks to the camera. She is identified as Kristen Gosani, PNP, MSN, Pediatric Nurse Practitioner, Neurosurgery Clinic, UCSF Benioff Children's Hospital.
One of the most rewarding things about taking care of kids with craniosynostosis is that we get to watch them grow up. We typically follow them until they're 12 or 13 years old. And a lot of times we've seen them since they were a tiny baby. Parents coming in with a newborn
The orthotist gently touches a baby's head, held by its mother. A baby in a helmet looks up from behind a wooden structure. A father holds his toddler, who plays with a tape measure, smiling.
3-month-old, and they're finding out that their baby needs surgery, and that's a very vulnerable time for them. And watching them grow up over time and live healthy, normal lives is very rewarding.
Dr. Sun observes a father and his toddler in a helmet in a hallway. A young girl with braids laughs, looking to the side. The girl high-fives a medical professional, while an older woman smiles nearby. A woman in a gray vest speaks to the camera in an office. She is identified as Erica Espinoza, parent.
When we first came to UCSF and met Dr. Peterson, we didn't know about my daughter's diagnosis. He gave us a lot of information. He gave us places where we could research for whatever questions we had other than what he already answered. They were very helpful. They were like visiting friends and family.
Dr. Sun speaks to Erica and her family, including her doctor, in an examination room. Erica listens intently, touching her face. Her daughter adjusts her long curly hair, looking thoughtful. Dr. Sun smiles, looking at a computer screen displaying photos of the daughter's face. Dr. Sun speaks to the family in the hallway, shaking hands with Erica. Dr. Sun takes a photo of the daughter with his phone, who smiles for the camera.
My daughter is doing great. She's 14 now, she's a teenager. She had her surgery 13 years ago. She was able to have a normal life, thanks to UCSF.
Erica speaks to the camera. Her daughter hugs Dr. Sun as her parents watch with smiles. A man wearing a blue sweater and glasses speaks to the camera in an office. He is identified as Nicholas Millar, parent.
When I found out that UCSF was the leading hospital in the Bay Area for this procedure, it made me very comfortable. It gave me and my wife the support to move forward with the minimally invasive surgery.
The outcomes with minimally invasive surgery can be as good or even better than open surgery.
Dr. Sun speaks with Nicholas and his wife in an examination room, while their child in a helmet stands nearby. The child walks down a hospital hallway, looking up. Dr. Sun walks down a hospital hallway, smiling at Nicholas, child who walks ahead of him. Dr. Pomerantz speaks to the camera. Dr. Pomerantz sits with a female nurse, holding and gesturing with a skull model.
And so at UCSF, having all of these techniques at our disposal has allowed us to really tailor what the best treatment is for each child.
Dr. Pomerantz speaks to the camera. Nicholas adjusts a blue cranial helmet on his toddler's head. Nicholas speaks to the camera.
The support that we received from UCSF Children's was phenomenal. They put our child first, but not forgetting about the parents. And so they made sure that every step that we were informed what was going to happen, how it's happening, and then the care going forward.
Nicholas's son smiles and looks at the camera.
Raphael now is doing great. We envision that Raphael will have a completely normal life post-procedure.
Nicholas speaks to the camera. He, his wife, and their toddler pose for the camera.
And that's all we wanted.
white screen with text. To schedule an evaluation with the Pediatric Craniofacial Program, contact us at San Francisco 877-822-4453, 877 UC Child, Oakland 51042-83319, and the UCSF Benioff Children's Hospital's logo.